Hello and welcome to Inside Edition, where we discuss national, regional and international issues in depth. Held under the patronage of the chairman of the Supreme Council for Health, the SCH, Lieutenant General Dr. Sheikh Mohammed bin Abdullah Al Khalifa, the Kingdom of Bahrain hosted recently the first Bahrain International Medical Conference for AIDS as part of Bahrain's pioneering role and distinguished efforts exerted to boost awareness of ways to combat AIDS. The conference brought together a host of international experts in the field of combating AIDS. In addition, a large number of doctors and specialists from Bahrain and the whole world took part in that essential event. To know more about it, we are pleased to be joined by internal medicine and geriatric consultant at Salmaniya Medical Complex and the conference chairperson, Dr. Jamila Al-Salman, right after this. Welcome back, dear viewers. Joining me here in the studio is internal medicine and geriatric consultant at Salmaniya Medical Conference and the conference chairperson, Dr. Jamila Al-Salman. Thank you very much for being with us today.
Thank you so much. My pleasure.
Doctor, first off, congratulations on the success of the conference. We've heard a lot about the information that was going into making this conference possible. The first Bahrain International Medical Conference for AIDS. It was held in line with the Kingdom's efforts to increase the awareness and commitment to address AIDS, not just in Bahrain, but in the region in general and abroad even. Can you give us a broader idea about those efforts as well as the importance of why it's important to shed light on the topic?
Yeah, absolutely. I think this is very important questions that you address right now. Looking at the HIV as a disease and AIDS in general, probably people know it more by AIDS. The problem's still there. You know, some people, they think that it's not there anymore. You know, we are not seeing more cases or patients of HIV, but it's there. If we take the numbers from 2021, for example, we have 38.5 million people across the world living with HIV. There were 1.5 new cases of HIV 2021, and there are around 650,000 deaths from HIV in 2021. So still a disease that has a burden and it affects people in their life. You know, with its modes of transmission that can be preventable. That in alignment with the direction from the highest authority in our country, from His Majesty the King, His Royal Highness the Crown Prince, the Prime Minister, for their direction to improve the health services in Bahrain and to provide the best quality of care for everybody. Equity of care is a major goal for all of us here. And doing this conference to really shed the light on the concept for the AIDS disease, how to prevent it, what's the best tools for diagnosis and early diagnosis, very important, and what we have, what modalities right now we have for treatment. And these are all important because they are part of implementation of the National Strategic Plan for Bahrain, which is usually updated and run by the National Committee for Prevention of HIV, which is headed by Her Excellency the Minister. And there where we have our Bahrain National HIV Combating HIV Plan. And this strategy actually goes in alignment with the WHO strategic goals for combating HIV and with the United Nations, which Bahrain, as a kingdom, we are highly committed to implement all of its objective. And this conference was actually just to put things together. It's not for Bahrain, it's for all the region. And probably when we talk about the agenda of the conference and the speaker, the variety of the speaker, to really take their experience, knowledge, updated information and give it to everybody, share it to move forward for the care of HIV patients.
When we talk about, you telling us about how broad the idea was that was implemented in the conference and the things that were actually addressed, how do you value the constant royal and government support provided to the kingdom's healthcare sector in specific and its leading initiatives, including holding an event as big as the one that just happened?
Absolutely. We couldn't do something as big as this. And it's one of the first kinds. It's never been done even in the region to have a full conference for HIV. And it's addressed for all healthcare workers, despite they should not be and they that infectious diseases or virologists to be able to attend. No, it has to be addressed to all, and that was major objective of this conference, is raising the awareness, education about the disease for the healthcare worker, whatever their subspecialty. But the royal and governmental support in our country really elevate the bar. What we are looking for here in Bahrain, we're trying by this conference really to put and make Bahrain as a hub for international conferences where we can get all experts to introduce not only within HIV, other diseases where we reach in the world, and that will reflect in the kind of service we are providing in the kingdom. So that's very important, where we can get all professionalism, professional and expert physicians, scholars to share their research, updated data, put it together and take the experience and try to implement. This is very important. This exchange of information, I know that probably within the last, as everybody know, within the last 2-3 years with the COVID-19, a lot of the things has been done on virtual, and coming back to really a full conference where we have attendees and it's face-to-face discussion, probably it's a kind of achievement for us, because we are really almost back to normal, where we can have this sitting for other conferences and build more success. So it's really, this really support from the highest authority, really it paved the pathway for more advance and achievement.
Absolutely. When we talk about a topic as big and massive as AIDS and HIV, when you come and do the conference, there are certain goals that you set for yourself. So can you tell us about what are the main goals of the conference in addressing this big subject?
We thought of it, part of the planning and organization for the committee, for the conference, and there were major objective. I think the number one is really to increase the level of awareness and education, and it's for everybody. And this conference was open for actual attendees, and for virtual. So we have around more than 650 people attending the conference. And this is amazing for very specific topic, it's HIV. This is really a great turn, a number that we saw, attending, and they stayed the full day, and second day was Friday till afternoon, and people were there asking questions. So they were really interested in knowing more about the disease. So that was one of the main objectives. The other one, which is very, very important, what's in relation to HIV and that we have to address, is the stigma about the disease. And this is really a major issue, and it's not only in Bahrain or the region, it's all over the world. The stigma around this disease, we have to eliminate it, because it really restrict even if you have the best healthcare facility and all the medication, that stigma can limit the access of the patient to the healthcare system. They will be worried that somebody knows, or how they will think about them, and who they will see probably in the hospital, who will talk to them. That limit their ability really to receive, even if you have the best quality of care. So that's very important for us as physicians and for health system in any country in the world. The other thing, as probably I mentioned, is the exchange of information, exchange of experience. There are countries where they have more and longer experience with dealing with HIV. And when I mentioned dealing with HIV, it's from education awareness, even the type of message that we have to give and address which population, and then to the diagnostics, changing all the time, and the therapeutics, the treatment, it's updated. And probably the HIV disease is one of the diseases rarely that the guidelines get updated at least once a year. And most of the diseases they don't, because there are a lot of research around the world that address this disease. And the fourth part, which is very important for us in Bahrain, it really puts Bahrain on the map, that we can be, as I said, a center, or a hub for carrying these international conferences, because it's of benefit for us in Bahrain and for all the health sector in across the region. And we have within the conference, from all probably the Middle East and the GCC presenting here, because probably they have the same issue, and they solve it. So probably we can take the experience. We don't have to restart from the beginning. And we have our experience in Bahrain that we want really to address. And one of the really major achievements in how our government really support us is the law, which it was issued from His Majesty the King about the right of HIV patient in 2017. That's put Bahrain really at leading further step in implementing all the strategies related to HIV.
And removing the stigma that you talked about.
Absolutely.
There were different topics that were discussed during the conference. What were the main ones that were addressed from your point of view that were important?
All of them probably, important, but we divided them. We put different kind of themes for it. We started, probably the first day with the epidemiology of the disease internationally and within the region, because the region has its own specification.
Yes.
And the challenges we have in our region. The main challenges we have in our region is a three parts, and some countries are doing very, very well, and because they have well-developed system and accessibility for the treatment and for the diagnostic, and other countries are not. It's not all the same. So main challenges that we face in the region is that still we are the region with the highest new cases, not the highest number, but the rate of increase and the related probably death or mortality, and that should not happen.
Yeah.
So that's why it's important. So major part was about epidemiology, the risk factor, and the prevention, how we can prevent it. And the other part, as we said, stigma, how to decrease the stigma, how to work. Then we have workshop about, how to deal, how to talk to the patients, probably their relative, and how to convey this information. Major part about the HIV itself, the treatment, the new medication, a lot of medication there, a lot of varieties that can we utilize. And the other, HIV and the other diseases. So we have HIV we talk about, and with the aging population, we have people now are aging because we have good medication for HIV. They are not dying young, they are living as long as the normal people, so they are aging. And with the aging, we have, a topic was about HIV and metabolic problem, like cardiovascular diseases, obesity, HIV and tuberculosis, because it's a major concern, both of them together. HIV and obesity, it's a major concern. And there was a part where we look for the whole picture, the role of the community, because NGOs has to play a part where we can deal with the community, about the general, our law in Bahrain, our legislation in Bahrain, because this is a kind of an ideal situation, and probably it can be an experience that can be shared by other country, the vaccination that they can get and how they can get it, and the role of healthcare worker and the public and really decreasing the stigma. So we try to capture as much as we can within 2 days. It was a very rich conference, and we really get great feedback from the audience and attendees.
That's amazing. One of the things that I keep hearing during what you're talking about in the conference is that dealing with HIV is actually a multidisciplinary team objective.
Absolutely.
So you have all of the team, from the nursing staff to the doctors to psychological doctors, medical doctors, researchers going in there. How important are the different aspects by themselves in order to make the patient feel more comfortable to come and talk about his disease and actually tell somebody that he has the disease? Because the fact is known, HIV, AIDS is manageable. It is a sickness that is manageable, and as you've said, people live for very long times. But if you don't come forward, then you will not be able to manage it, because that information is out there, but you won't be able to accumulate it. So what are the importance of each of the disciplines?
Absolutely, you cannot run an HIV service if you don't have all the support, because each of these disciplines is very important. We can start from the diagnostic and the lab, who is running the tests, and from running the test and confirming it, the system, and then breaking the news to the patient, when we inform them that this is the result and it's confirmed. This is probably where you need a social social worker help, a psychologist or psychiatrist to get on board if needed. Some of the patient really well educated, and they know a lot of information about disease, and it's easier the communication and to transfer the information. And then when it comes to the treatment, you need the ID or the infectious disease physician who specializes in HIV, and this is the concept, and I think you mentioned very important part, which is it's a multidisciplinary and it's multitask. So the HIV patient actually, because it's hard to tell everybody that they have HIV, so the infectious disease consultant or specialist who's seeing them becomes the primary care physician, becomes the family physician, where they can tell them everything. So at the same time we are managing HIV, we have to look for all the others, like risk factor for cardiovascular, if they have high cholesterol, if they have high blood pressure, we have to address exercise, nutrition, obesity. We talk with them about it, vaccination, are they updated or not? So we become the primary care and the family physician for them to make sure they receive everything as needed. So each of this, for example, if I need even consultation from, for example, for their hyperlipidemia, I need to consult endocrinologist. So this is where they have to play a role.
Yes.
And this is one of the major objective also that I mentioned, that the attendees for the conference were not the infectious disease. You know, this is the time that we talk to everybody. This is the time that we convey the message to everybody out there. And the other important, you know, point that you mentioned, which is true and probably not a lot of people know, it is manageable disease like hypertension, like cardiovascular, and the people with HIV live as long as normal people. And actually they get better services, they come earlier because they will get all the screening, and you know, they will reach the health system. At the same time, they can live normally, they can have kids, they can live a full normal life. This information very important for everybody to know, to be able to decrease the stigma and increase the linkage of care for these patients.
Absolutely. Knowing that should make it easier for them to actually come and seek the help they need. What is the importance of organizing a conference or an event such as this, and how does it serve to aspire the goals of the healthcare system in general in Bahrain?
It's an alignment, absolutely. It's an alignment because, you know, all the major objectives that we mentioned, from implementation, the full strategic plan for Bahrain, which is from the National Committee Combating HIV, to implementation of all the recommendations and the plans and strategy from the World Health Organization and United Nations AIDS. So all of this because Bahrain as a country, we have the higher level commitment for implementation and do the best. And the other part is where our experience, where we have really good experience and response to treatment, we can share it with the rest of the world and get more experience to really achieve more. You know, at the end, you know, each success actually takes you to the next, and this is what we're trying. And you know, and I think all the people who are attending, including the speaker, they were really you know, happy and admiring that Bahrain took the lead for conducting such a conference, because that's an opening really area for the implementation, because probably I mentioned there's still a lot of challenges in our region that we have to address, and we have to, you know, address it by education awareness first step, and looking for the current situation and then put the solution, and that's part of the recommendation of the conference where it will come.
Absolutely. How do you value the number of participants and speakers, especially the speakers? There are many speakers from all around, and they represented various countries and different points of view. So how do you value that such speakers came up?
Really, you know, there is, you know, really amount of words that, you know, can explain our really how grateful we are for them all. You know, I know that all of them are expert in their field and they are all of them busy, that really to be able to come and share what they have been passed, because as you mentioned, they are from all over the world. So this is where everybody can get to be able to, you know, for the objectives to be accomplished. And, you know, the speakers, they really they give great presentation, and, you know, everybody was really happy about it, and they convey the message as we have to, and really special thank also for the attendees, because they took the efforts. You know, that will not be successful if we don't have attendees. So, you know, they took the time. It was Thursday and Friday, and they were attending and they were listening. They have questions, a lot really of high-level engagement, which we saw it there. And I think, you know, that just gives us that main objective of this conference has been accomplished already.
Absolutely. What can you tell us about your participation at the conference this year?
Well, you know, I had really an honor to be part of really a large team. We learned over the years, and especially with the COVID-19, teamwork is the best thing to make something successful. Brilliant people, really talented people. We have the organization committee, we have the scientific committee, where and the logistic, you know, team with the, you know, collaboration with the organizer Education Plus company. These people are really worked too hard over the last several months to make this happen. You know, a lot of behind the scene arrangement and calls and, you know, arrangement and, you know, updating the agenda, revising the objective, make sure that everything's good, everything is up to standard. So really it's a huge, you know, efforts from everybody. It's a big team. And we cannot thank everybody, really. And that's the success of being able to work with a team and be able to really, you know, give this level of scientific conference.
Absolutely. When we talk about all of the things that go into making a conference, you said the scientific committee, the media committee, research committees, everything is a part of it, and that's why one of the main important things that come out of the conference are the outcomes. So what are the main recommendations and outcomes of this conference specifically, and what are the suggested procedures or changes that should be implemented?
Yeah, regarding the recommendation, we were like each theme, we'll discuss what's the main that we convey. This recommendation not only, as I said, to Bahrain, it's for the whole region. So the main recommendation is to intensify the amount of awareness and education, not only for the health sector, and it's also for the public, because this is where prevention starts. And the public in all the countries in the region, they should know what kind of services available and how they can approach a health institution and ask for testing. This is very important. So education is very important. The other part, again, I probably mentioned it, is the stigma, how we can all work together to decrease the stigma, to be able to perform, because otherwise we'll be just staying where we are and cannot progress. The other thing is to how the countries really, and that's also learning from the COVID-19 pandemic, is how to maintain the health system if you have a pandemic, how to maintain the drug supply for the patient, and the services, testing and follow-up for the patient who are affected with HIV. And the fourth probably recommendation is how to improve testing, because we said testing early, getting the patient early, they have the best outcome. You don't want to see a patient late in the disease, because the best outcomes when you get them earlier. So having this testing, improving this testing, introducing new modalities for the countries who does not have them, to add it to the the kind of flow chart for testing is very, very important. And the fifth, probably with all the advances in the treatment, I think the countries, are really blessed in Bahrain to have updated medication, the new medication all on board. But I think, the other countries, how they can manage and how they can provide the best quality of therapeutics for the patient.
Definitely. Well, before we end today's show, from your point of view, how do you see the successful future national and international ways to combat AIDS?
Really, I'm thinking, what will happen after this, the success of this conference, and how people really, with their physicians, nurses or pharmacists, or even non-healthcare worker, look at it and they value the information. I think this is, as I said, it's really an opening, a new chapter in the field of HIV in the region, where we have to sit all together to reach from having strategic plan to full implementation to be able to achieve this goal. And I know that probably there are variations. Some countries achieve a lot, and some are there trying, and some they are starting. So this is the part where exchange experience can put us together. And not only in the region, having international speaker, international collaboration will really lift the level for the quality of service for the HIV patient. And that's what we are looking for. And I'm sure it's going to happen, maybe take time, but it will happen, inshallah.
Do conferences like this have to be repeated from your point of view in order to add to the experience that is collected?
Absolutely, absolutely. And that's one, this probably was the last recommendation that I didn't mention, is that it was obvious, everybody, attendees and speaker, it has to be repeated. Because, as I said, the success was there. We were seeing it, session after session, and how people were really positively engaged and they want to hear more. So we will be deciding about the duration. Is it every 1 year or 2 years? That as more information and change and update in the natural progress of research in the field. But inshallah, it's happening.
Inshallah, looking forward to it. Thank you very much for being with us today, for answering the questions that we had for you, and congratulations again on the success of this event.
Thank you so much.
And we'd like to thank you, dear viewers, for watching us, and we'll see you next week in another episode of Inside Edition.